It's Tuesday. It's December 19th, 2023. In the quiet of the residence, I'm watching some of the news outlets that are coming out, some of the headlines um, that are concerning to me. Um, and I'm thinking of the injury that I just sustained in the hospital system that I went to, and then how the hospital system has changed over my life frame. Um, for my entire life, that I've been aware, when somebody breaks a bone, normally one gets what's called a cast. They spell it CAST, made of plaster and some other kind of material. Um, I broke a bone. I had some special procedure done at one of the local hospitals. Um, and for some reason, they're not offering casts anymore within the medical community. I'm not sure what that's about. I don't know if that's a socio-political move. I don't know if that's for the benefit of the patients. I don't know if that ties in or is related to any of the other stuff that is going on in the local area that I'm not a part of or not aware of. Um, what I do know is that I am 3 weeks from the initial breaking point, and right now I can see my foot. It's only in an ace bandage. It's been repaired by surgery, um, but it's not in that cast. So, and they have this new, and again, I don't have access, I watched different television programs. I was watching. My son came over and suggested um, that I watch something called House of Dragons, which I had never. Lynn and Lou were watching it. I think it's something to do with Game of Thrones. So I watched one episode this morning. Um, they talk about for the Hand of the King, like the miser. I guess that would be their chief medical officer. And in it, like, I don't really know, but that's like my logical guess to some of the other shows. Like when I watch a Star Trek and what their vocabulary is, because in the local area, the vocabulary is not very um, consistent. So, other things that I'm noticing is, as far as my medical care goes, I have my foot turns like a purpley blue, indicative of blood flow and circulation is not. I mean, I was having trouble before the injury, but now after the injury. Um, so I'm concerned about that. I'm also concerned because I have weakness. That's, like it's one thing to have a little muscle weakness, to go to the gym, work it out, and then have a lactic acid buildup, which is what used to happen to me. And then, after a few days, the lactic acid would dissipate. And that would be the normal physiological process for living and growing up in this area. Um, Unless I was on one of my time frames where I was consistently going to the gym and there was no lapse in physical fitness regimen, depending on what I was doing in the field. So um, I'm not having that lactic acid buildup and then strengthening of the muscle as a physiological response. Um, my When they took the cast off, it's only been 3 weeks. I could see an actual impression in my calf muscle, which now looks hollowed out almost, like loss of muscle mass. But more so, the muscle mass is not retaining rigidity, and Again, I don't know if it's malnutrition. I don't know if it's lack of medical advice. I've had these bouts of anemia that were not rectified, or were not restorative. Like, I was never offered restorative process in order to fix the anemia until later on, just recently. Um and then my phosphates got thrown off. Now the doctor tells me, and this is the conflicting. I have my hematologist who says that I need to go for hydration and phosphates to build my restores back up. And when I'm home, it's this powder packet 3 times a day, mixed into water per day, in order to build my phosphorus back up. And that was before I had a broken bone. Um, when I only just had muscle weakness, but couldn't really figure out what it's from. Now I'm in a different process, because of the broken bone. And she sent me to a nephrologist that she highly recommended, and that they're in consultation with each other. And for some reason, the person that she's conferencing with and recommended, he took me off of hydration completely. Says I don't need to be going in for the special chemistry bags of fluid and phosphates and whatever else is in there, in the hydration. And he cut me down to once a day on this Fosnac. And when I called my doctor, she's now away for an entire month, 2 months. She's not going to be back until the end of January, almost beginning of February, like the day before February begins. So now I don't have the woman that I'm supposed to trust, my normal doctor. Um, and the doctor that she recommended took me off. Um, and now I have this broken bone. And I heard through someone, one of the doctors or staff that I spoke with, said that you need vitamin D and you need phosphorus to build bone, or like in some process which I'm deficient in malnutrition. Um and I'm just not getting the right level of medical care for a restore, like if the end goal is restorative process to peak performance as a human being, or as a whatever within the system in the United States of America, within the federal reserve system. I'm not getting that throughout the US. I keep getting bounced around in the local area to different medical practices, then under the umbrella of one hospital system, but then the doctors in between there are not cohesive. Um, Positive note, when I met with the surgeon multiple times before and after, and his staff, the one who put they now have the removable boot instead of a cast. I don't know what that has to do with anything. Um, and so I met with the person who fits for the boot. I met for the person who did the surgery. And then I met with the PA. And so that was uh, a nice, um, educated um, meeting for what's going on with this process. What was not spoken about, just so, because again, I saw as I was leaving the surgeon's office, I saw what sport, what team, and some pictures with some other paraphernalia in a glass case. I'm just observant of it. I'm not saying it at the moment. Um, so I'm aware of that. Um, But what was not talked about was the nutritional aspect of it. And going into the surgery, I've had muscle weakness that has not been corrected. And again, I use the word rectified, um, in a restorative, corrective state. But again, I don't know what rectory they're going through and if that might be part of the problem. Um, but I'm now having a problem with, um, I'm suffering from this muscle deterioration, and I'm not getting, and again, Google is whatever Google is. I had the course of normal anatomy physiology, so I'm slightly ahead of the curve on being able to have an educated conversation, but at a novice, very novice level. I haven't studied the disease process. Um, but I'm having this weakness, and uh, I don't know why after a break in a bone the doctor would remove the hydration process and the monitoring that way. He's monitoring a different way. He's now sending an agency in to collect a vial of blood once a week. And then but that's what the doctor out in Suffolk County was doing when I first had the anemia that was going on for years without even referring me to a specialist or referring me to, and like, in an active, like, I would see him once a month and every 3 months do a blood draw, and it kept coming up, platelets were high, anemia, but like no what to do, what could be causing it. Like there was no even attempt out in Suffolk County for the doctor that I was seeing to even get me into the direction I needed. So I just kept falling further and further behind with just this feeling just lousy and trying to just, I don't know, trying to make it through. And balance business and the kids and the house and all of the things that come along with having to live this way. But now, again, I'm still in the same conundrum of I'm not getting the correct answers, even though the set of doctors have changed. Um, and I'm getting this bounce around, like the nephrologist taking me off the Fosnac and telling me to reduce the amount that I'm taking in. And I also noticed a change in my vision all of a sudden, which is frightening, because it is a reduction in my ability to see correctly. And again, I don't have the level of doctors or access to the level of doctors that are putting it together for me to make sure that I'm not getting worse. It just feels like I just keep getting worse, and I don't know where to go for the correct set of doctors under the correct set of circumstances in order to restore my health so I don't get worse. And I mean, like, the optimal is to grow old gracefully, and that is so not happening at the moment, and I don't know how to get back to being in a place and finding the correct persons to help me along my journey. It's so frustrating. um but that's what's going on right now is the foot, the ankle, it looks like this, and it's off cast. So it's off cast for now. Um, I had pictures of it when it was in a soft cast, and now it stays like this for the majority. They send me to physical therapy, um, and then it's the removable boot, um, for leaving the house or going out of the house. And again, I don't have access to the miser. Like, if that's a word and if that person exists somewhere, I don't know where that is. I don't know if New York has one. Again, um, it's just I'm just making note on my own behalf to protect myself and my kids. Not really being part of the medical community, but being one of the persons who have sought out their help um, in multiple facilities, uh, and can see and just have had some experiences throughout it, but don't know how to get the correct medical care that I need, um, as far as like the nutritional aspect of it, and to regain my muscle tinsel and my muscles being able to work properly and not becoming so flaccid and just disappearing. Um, just over a 3 week period, it was frightening to see the difference of just how much muscle mass was lost in this one limb. Um, so it's at star 1978, star 8378, Nicole Cataruza. It's Earth, solar system, Milky Way, universe, galaxy is broken at the moment.